Hello, this is Carly Cason, and today I'm going to present an overview and exploration of the Web Poison Control Poison app created by National Poison Control Centers. This presentation will take a comprehensive look at the application features, including relevance, practicality, ease of use, and convenience. Poison Control was developed for users facing a poison emergency, so they would have easy access to all the benefits of the Poison Control Center right at their fingertips in one simple-to-use application. After opening Web Poison Control on your mobile device, the first screen that populates is the Before We Begin screen. This is an important first step for users as they are given the option to complete the 6-step questionnaire or call Poison Control directly. The goal of the questionnaire is for the app to triage the user's symptoms in less than 3 minutes and provide recommendations for treatment or symptom management. In addition, Web Poison Control has listed in several different places throughout the app what criteria the exposed person must meet in order for the questionnaire to be appropriate. Humans who are usually healthy, who have been exposed to a single substance, are generally the best fit for the application use, as the application cannot take into consideration a person's comorbidities. And yes, I did say humans only because Web Poison Control cannot be used for pets. The Web Poison Control app has unique features that can help educate users about different substances and interactions. The app is a great tool for nurses to present to their patients when teaching about medications and side effects. Unintentional overdoses can happen, and informing the patient about this application and how to use it can help to cut down on unnecessary healthcare costs associated with hospital visits. Another handy feature for patients and nurses alike is the pill identifier, which allows any medication to be located based on imprint code, color, and shape. Nurses could use this tool regularly in a hospital setting to identify patient medications. Once it's determined that the user meets criteria for use, then they may begin the 6-step questionnaire. Step 1 asks general information about the person experiencing the possible poisoning, like age and sex. If the person is not pregnant and the poisoning is unintentional, then the user can proceed to Step 2. Step 2 is a search engine to locate the involved substance, which can be searched by name, appearance, or barcode. Once the substance is located and selected, then Step 3 is to confirm the substance. Step 4 asks the route of exposure, and Step 5 asks how much additional medication was taken. After the questions are answered, Web Poison Control will present the results immediately. The results can vary depending on how the user answers the questions. If Web Poison Control presents our recommendation screen at the end of the questionnaire, this means that the person experiencing the poison emergency has an unlikely chance of developing serious toxicity and should follow the first aid tips provided. If the user is presented with a "sorry, we can't help" screen at any time during the questionnaire, then the user should stop using the app and call Poison Control directly. At the top of the screen within the app are 2 icons, a blue question mark and a red exclamation mark. These icons represent different shortcuts to direct the user to frequently asked questions or more detailed information about poison control. 2 other easy-to-use shortcuts are the phone symbol, which dials Poison Control directly, as well as the Get Help Online button that takes the users back to the questionnaire. Web Poison Control app is free to download on Apple and Android smart devices in the App Store or on Google Play. The app uses simple question and answer format, which allows the user to easily navigate and obtain the desired information. There are many routes of poison exposure caused by substances, and Web Poison Control takes a customized approach and determines if the suspected poisoning is serious or not. This is done for the benefit of the user to avoid significant illness or even death if the poisoning is deemed serious. According to the terms of use, the intention is not to replace a physician, but to triage symptoms to determine if symptom management can be done at home. The application warnings that advise the user to call Poison Control should never be overlooked, as the potential for adverse outcomes is high if medical attention is not given. If the user seeks medical attention, then this is the only time a Poison Control agent willingly provides the user's information to the physician or nurse in charge of the care. Overall, there are many benefits to downloading and using the Web Poison Control app. The app is convenient for families with young children who may have accidentally ingested a bug, a substance, got a chemical in their eye. Elderly users can also benefit if an unintentional overdose is suspected. The questionnaire that triages patient information is quick and easy to follow, and there are very few but potentially serious limitations, such as the user minimizing symptoms and not truthfully answering questions, which could result in a delay of care. Users must have Wi-Fi on their smart device to use the application. Regardless, I would highly recommend this app. In conclusion, Web Poison Control application allows users to take a quick and easy 6-step questionnaire to determine poison toxicity in less than 3 minutes. If poisoning is suspected, the application has a first aid chart detailing quick measures to take that can make a difference in outcomes. The application is extremely user-friendly, but does provide the users the option to call Poison Control directly if further assistance is needed 24/7. Lastly, Poison Control is a well-known service that has been around for a long time, so it is with this reputation that users can have confidence for all their poison control needs via the Web Poison Control app.